Hello everyone, how are you? Hello friends or Project PIMG, my name is Jorge Benito Viana. In this installment, I'm going to explain postpartum complication as a part of obstetric course for the Step 2 USMLE. Remember that the contents are based on the most asked questions in the exams. This is the Project TMG, the largest growing medical community and the hottest free platform to help doctors with everything for their USMLE US journey. With that being said, let's continue. Okay. In the first slide, you see that the contents of the postpartum complications are postpartum hemorrhage, postpartum fever, atelectasis, urinary tract infection, endometritis, wound infection, septic thrombophlebitis, infection, mastitis. Postpartum hemorrhage is blood loss from vaginal delivery, more or equal 500 milliliters, or from cesarean sections, more or equal 1000. The causes are uterine atony, lacerations, retained placenta, disseminated intravascular coagulations, uterine inversion, and unexplained. Next, about uterine atony, risk factors, a rapid or prolonged labor most frequent. Chorioamnionitis, medications MGSO4, beta-adrenergic agonist, halothane. Overdistended uterus. Clinical features. Uterus soft as a mass palpable about the umbilicus. Management, uterine massage and uterotonics such as oxytocin, carboprost, or methyl large novin. Yes? In the next, we talk about lacerations. Lacerations cause 15% of heavy postpartum bleeding. Risk factors. Uncontrolled vaginal delivery is more common, difficult delivery and vaginal delivery. Clinical features. Identifiable lacerations in the cervix, vagina and perineum. There is contract uterus. Let's see. Management, surgically repair. Okay, retained placenta. 5% of postpartum bleeding is due to excessive retention or the placenta. Risk factors. Accessory placental lobe, most frequent. Abnormal thromboblastic uterine invasion, cervix, vagina, and perineum. Clinical features. There are no placental correlates with the uterus contracted. Management. Uterine curettage of manual extraction under ultrasound control. Yes, we talk about disseminating intravascular coagulation. DIC is rare. About risk factors, placental abruptions, amniotic fluid embolism, severe preeclampsia, retention of the dead fetus. Clinical features, lacerations in contracted uterus, generalized suppurations of bleeding from intravenous sites. Management, extraction of pregnancy tissues from the uterus, support in ECU, also selective replacement blood products. Uterine inversion. Risk factors. Previous uterine inversion, myometrical weakness. Clinical features. Must please with a fleshy in appearance in the vagina and without abdominal palpation of the uterus. Management. Replacement of the uterus while lacing the vaginal pharynxes and placing the uterus in its normal anatomical positions. We then give intravenous oxytocin. We talk about unexplained. If in addition to the surge a cause that can be corrected for the continuous bleeding is not found, it is necessary to perform a laparotomy and surgically ligate the internal iliac or uterine arteries bilaterally. As a last option, we do hysterectomy. Postpartum fever is fever greater than or equal 38 C at more or equal 2 times greater than or equal 6 hours apart, no counting. The first 24 hours postpartum. Postpartum period day 0. Risk factors. General anesthesia is given. There is pain in the incision commonly and the patient is a smoker. Clinical features, mild fever, reels, the patients cannot take a very deep breath. About the management, give pulmonary exercises, deep breaths, spirometry, and ambulation. Postpartum period day 1 and 2, risk factors, multiple intrapartum characterizations, and vaginal exams that do prolong the labor. Clinical features, high fever, costovertebral flank pain, positive urinalysis, white blood cells, bacteria, and urine culture. Management, single and intravenous antibiotics. Yes. Postpartum period day 2 or 3, the most common cause of postpartum fever is endometritis. Risk factors, emergency cesarean sections after prolonged ruptures of the membranes and the prolonged labor. About clinical features, moderate and high fever with exquisite uterine tetanus, peritoneal signs should be absent, peristalsis must be. About management, multi-agent intravenous antibiotics, as an example, gentamicin and clindamycin. This is as an example, to cover the polymicrobial flora of the genital tract. Respect a wound infection, the risk factors, emergency cesarean sections after prolonged labor and prolonged ruptures of membranes. Clinical features, fever that remains despite the administration of antibiotics, erythema, fluctuation or drainage of wound. Management, wound drainage with to dry packing approximately twice a day. Intravenous antibiotics for cellulitis, for the abscess forced closure by second intention. Later, septic thrombophlebitis, postpartum period day 5 and 6, risk factors, emergency cesarean sections after prolonged labor of the rupture of the membranes. Clinical features, fever change that persists despite the fact that we give him broad spectrum antibiotics, normal physical and pelvic exam. Management, intravenous heparin for 7 to 10 days. Maintain PTT values between 1.5 and 2.0 times the values we gave at the beginning. Postpartum period day 7:21, infection mastitis. The risk factors are trauma to the nipple during laceration leading to cracking of the nipple and allowing Staphylococcus aureus to enter the ducts and lobes of the breast. Clinical features, variable fever with localized unilateral breast tenderness, erythema and edema. About the management, oral cloxacillin, continue breastfeeding, ultrasound in if lacerational mastitis does not respond to antibiotics, rule out an abscess. Okay, that's all for today. I hope I have served you. See you in the next video, and this is the Project TMG New York to the world. Don't forget to subscribe and like. Bye bye. See you around.
Mantente conectado a TechMed. Si el contenido te parece interesante, compártelo en tus redes y suscríbete a nuestro canal. Ofrecemos técnicas y material de estudio a través de todas nuestras redes sociales de manera gratuita. Muchas gracias por vernos.